Hi, welcome to 10-Minute Medicine. I'm Caroline Evenden and I'm going to do a presentation today on how to manage open fractures. So the most important thing to know is open fractures are an emergency and you'll definitely need senior support in managing these patients. So an open fracture is a fracture that is exposed to the outside environment, outside of the environment of the body through a break in the skin or soft tissue. So to assess these patients, it's time critical because certain management will need to be initiated early. These are most likely high energy trauma patients, so they will need an ATE assessment before stabilizing of their limb, as they may have other life-threatening injuries. Some, for example, if you're in a major trauma center, will most likely come in as a trauma call, so you'll have a large team with lots of specialties there helping you. For these patients, it's important to take an ample history. If you don't know what this is a short history that's just allergies, medications, past medical history, last time they ate, and the event, to make sure that you get history within the time constraints. Getting IV access is important because you'll need to give IV antibiotics early, and getting a senior involved if this hasn't been a trauma call. So managing these patients after you've done an A2E and stabilized their other life-threatening injuries, you need to get IV antibiotics straight away. The type of antibiotic will depend on your hospital policy. Remove any large bits of debris with sterile forceps, but do not perform a mini washout at this point. It's important to take photographs of the injuries. So, for example, the consultants who are going to be doing surgery on later know what it looked like when it came in. You'll obviously need to consent for this, and every hospital will do it differently. For example, putting photos online. And then the fracture will need to be reduced, which obviously will most likely will require senior support. Whenever you reduce a limb, you need to check their neurovascular status. The wound should be covered with an occlusive dressing, and after the limb is aligned, they might need splinting. And after aligning a fracture, as always, you need to get imaging after the reduction. But for these patients, because they're most likely a trauma call, they'll probably get a trauma CT, which is CT from head to toe. These patients, as you manage them as a trauma with ATLS, they'll have a primary survey. You'll have to stabilize their injuries, so you get the primary survey. Then it's important to do a secondary survey to see what injuries you might have missed. And all these patients with an open fracture will need admitting. And the thing to think about is, can this patient be managed in the hospital you're currently at, or do they need to be transferred elsewhere? An open fracture needs a specialist centre that has orthoplastics. So obviously this will not be your decision, this will be a senior decision, but it's important to know and understand when patients need to go to theatre straight away. So an obvious one is if they have compartment syndrome, or if they have particularly contaminated wounds, for example, from animal feces in a farming accident, or contamination from when this happened in water, an injury that's happened in a sea or a lake, or if they have any neurovascular compromise, for example, if they have arterial damage and you need to get the vascular surgeons involved. So the definitive management for these patients is they need to be transferred to a centre that can do the specialist care, so an orthoplastic centre, and they need to have debridement and surgical washout. So this either needs to be done immediately as an emergency, in the cases that we just said, or within 12 hours or within 24 hours. And also, obviously, these patients have a fracture, which will need to be fixated surgically. This might be able to happen at the same time as a debridement or at a different time.